Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Runny nose, watery eyes, and congestion can be symptoms of a cold, or it could be seasonal allergies. Today, we'll be talking about what to do if you think you may have seasonal allergies with Dr. Mark Arnold. He's an assistant professor of otolaryngology and communication sciences at Upstate. Welcome back to The Informed Patient, Dr. Arnold.
Thank you for having me.
If I understand correctly, seasonal allergies most commonly are triggered by pollens released by plants at different times of the year. So can you tell us what we're most likely to be dealing with in the spring, summer, and fall?
Yeah, you're exactly right. Pollen is the main driver of these seasonal allergies, and different types of plants release pollen at specific times of the year. And these are carried by the wind to help, plants reproduce. But in the spring, it's mostly trees, especially species like birch, oak, maple, and ash. They release large amounts of this light airborne pollen that can even travel for miles, eventually affecting our nose and our eyes. During the summer, the primary culprits are grasses. Common grasses include like Timothy grass, Kentucky bluegrass. Further down south, there'd be Bermuda grass. But people who are sensitive to grass pollen might notice symptoms more when they mow the lawn or spend times in parks. And then in the fall, the biggest offender is ragweed and other weeds. These can typically start in August and they last until the first frost.
And we don't have to worry about this in the winter, right?
Correct. Those pollens are not as prominent in the winter, but we do have indoor allergens to molds, dust, and insects, which can cause symptoms more prominently in the winter and also year round.
So if people are allergic to trees, say, are they usually also allergic to grass and weed?
It's a good question, but some people are allergic to just kind of one category, but about half or more of people are what we consider polysensitized, or they're sensitive to multiple pollen types, either within a certain class or multiple classes. These can lead to longer lasting symptoms that stretch across several months. It's also unfortunately possible to become sensitized to additional allergens as we go along and get exposed to other types of pollen. So just because someone starts with a tree pollen, they might also later develop sensitivities to grass or ragweed as well.
I see. Now, what is happening in our body when we're exposed to a seasonal allergen?
So when someone inhales allergens, there are proteins that the immune system mistakenly sees it as a threat, kind of like how we would react to a virus or a bacteria. And then the immune system responds and it releases histamine and other inflammatory chemicals. These trigger our typical allergy symptoms, things like sneezing, nasal congestion, itchy eyes, runny nose. Sometimes people can also be fatigued if they're having trouble sleeping due to these symptoms due to congestion.
Do we know why some people are plagued with seasonal allergies and some people it doesn't bother them at all?
Ultimately, it's a combination of genetics and environmental exposure. If both of your parents have allergies, for example, you're more likely to develop them. It's not just genes, however. Childhood exposures to allergens, pollutions, even infections can influence kind of how our immune system develops and whether it becomes allergy prone or not. There's also the thought of the hygiene hypothesis. It's an idea that growing up in a very clean environment may increase the risk of our allergies because our immune system doesn't get properly trained. So at the end of the day, it's a variety of factors, basically the environment we grow up in, as well as our genes.
Do you ever see kids who struggle with allergies in childhood, but then they outgrow it?
Sometimes it does happen. Some may become less reactive, especially during their teenage years. Unfortunately, it's more common for allergies to persist into adulthood or even return later in life or get worse. Typically, in the very later decades of life, allergies kind of decrease in symptoms, but for most people, they either persist or get worse in time, where a minority improve. This is a little bit different than food allergies, which is a different topic altogether, but many kids do outgrow those.
So, how does central New York compare with the rest of the country in terms of the severity of allergies?
So we here in central New York have a lot of distinct seasons, and that ultimately means that we have a rich variety of native plants, which means, unfortunately, that there's a significant amount of pollens, especially trees in the spring and weeds in the fall. Our climate's also fairly humid, which encourages mold growth, which is another allergen. So we're not the worst place for allergies, but we're certainly up there to having year-round symptoms as well as pretty bad seasons in the spring and the fall.
Now, this spring in particular has been pretty rainy and wet. Does that help allergy sufferers?
Yeah, the local weather influences pollen counts quite a bit, and for the most part, rain is a positive, or it reduces the pollen in the air by making it wet, making it sticky, making it keep on the ground, and therefore wind doesn't really have the ability to carry it as far and getting us exposed.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Assistant Professor of Otolaryngology and Communication Sciences, Dr. Mark Arnold. What are the symptoms, the most common symptoms of seasonal allergies, or I've heard it called, is hay fever the same thing?
Yeah, they are the same thing, and fortunately, most people, because it's such a prevalent condition, we have a pretty good idea of what those symptoms are, and those things are sneezing, nasal congestion, a runny nose, itchy eyes or throat, watery eyes, and postnasal drip. People may describe it like they're kind of on the verge of a cold, but it's not a cold. And they can have these symptoms, and then there can be some other ones that are related. Again, fatigue and poor sleep, especially if they have significant nasal congestion and it's difficult to breathe at night.
Is fever ever part of it?
No, fever is not a symptom of allergies. Fevers, body aches, or swollen lymph nodes, that's more likely a viral or bacterial infection. That's an important clue when trying to tell the difference.
Now, people who have asthma, are they more prone to seasonal allergies?
Yes, allergies and asthma were considered kind of one unified airway where inflammation affecting one affects the other, as well as their sensitivity to outdoor exposures and allergens. So they often go hand in hand. We also have a term called allergic asthma when pollen or other allergens trigger asthma symptoms. So when we're talking about managing these conditions, it can actually help controlling one by controlling the other. So controlling allergies can also help with your asthma symptoms.
And since the symptoms can be similar with a cold, how does a doctor tell whether it's a cold or whether it's allergies?
It really boils down to the timeline. Colds typically last, from 5 to 10 days, maybe a couple weeks. And they also have other symptoms such as a sore throat or body aches or fevers. Allergies, on the other hand, are more of a chronic condition. They can last for weeks and months. They also have a little different symptom uh, kind of picture, which includes itchiness, especially in the eyes and the nose. And that's not really common for colds. So sometimes one is treated like the other, but they do have different presentations.
Can you explain how allergy tests are done and when they may be recommended?
So there's two main types. One is a skin prick test. This is where small amounts of allergens are applied to your skin, kind of using a small prick or a lancet. And if you're allergic, you'll develop a red bump at the site that can be measured and quantitate the amount of sensitivity you have to that allergen. The other option is a blood test, and that measures allergy related antibodies called IgE. They're both useful, although people with blood tests can continue to take their antihistamines and other medications. So they have different roles, but both can be used to test for allergens. And to the other part of your question, it may be important for some people to determine what specifically they are allergic to. There are panels that we use common allergens in the Northeast to help identify people's sensitivities. It's also used for immunotherapy or allergy immunotherapy to help determine a starting point for when to start that kind of treatment.
Now, I've heard the phrase allergic rhinitis. Is that something different?
So allergic rhinitis, it is similar to hay fever. It does include the constellation of symptoms that are nasal congestion, itchiness, and watery eyes. It's very similar, but we also make a distinction between allergic and non-allergic rhinitis. So non-allergic rhinitis may be similar symptoms, but without an inciting factor that is an allergy exposure.
So, rhinitis, is that runny nose?
It's a general term for inflammation of the nose, but it can include things like, you're correct, a runny nose, uh, as well as nasal congestion, sneezing, itching.
So, when someone comes in to see you with all of those symptoms, you have to figure out whether it's allergic or non allergic.
Exactly. It starts with a detailed history, trying to identify triggers, as well as things they have tried, things that have worked, things that have not, as well as a physical exam, looking in the nose, often using a small, tiny camera to look around, and that can help clue us into the diagnosis.
What are the treatments for allergic rhinitis? There's a lot of things over the counter, right?
There are a combination of medications usually work best. Antihistamines, or over-the-counter oral antihistamines are usually our go-to. Things like cetirizine, loratadine, or fexofenadine, these can reduce the itching and the sneezing. Nasal steroid sprays like Flonase or fluticasone or mometasone are also very effective for the congestion, as well as the postnasal drip, especially when these are used daily. So those are our go-to medications, mainly an antihistamine, as well as a topical nasal steroid spray. There are other medications that are over the counter as well. Decongestants, they can help, but they should be used sparingly to avoid rebound symptoms. And then there are some other medications, including leukotriene blockers. There's also eye drops for persistent symptoms.
Well, let's talk about the treatments for traditional like allergy medicines. Are they in the same category as the treatments for allergic rhinitis?
Yes, those do include the antihistamines, as well as the topical nasal steroid sprays. It depends on which is the predominant symptoms, whether it's sneezing, nasal congestion, or the eye itching, that may help guide one into one medication over the other. For example, the antihistamines can really help with the sneezing and the itching, whereas the topical nasal steroid sprays help with um, the nasal congestion, but they can also help with the other symptoms and well, including the eye symptoms.
But these allergies can be chronic, or even if they're seasonal and they come back every year, is it safe for people to keep taking these medicines long term?
Yes, these medications are over the counter and generally are safe for long term. Some of the newer second generation antihistamines also don't cause side effects that we've seen in earlier ones, such as sleepiness or drowsiness. So I recommend that they can be taken long term, as long as needed. Some patients, it may be helpful to take them just during the season or just slightly before their typical worst seasons come about. But some people have year-round symptoms, and we take these medications year-round as well.
What are the biggest mistakes that you see patients making when managing their allergies?
I think the most common problem is starting the medication too late. Oftentimes, these medications take some time to kind of build up and help prevent symptoms. So I often recommend starting nasal steroids a few weeks before an allergy season starts, or especially before it peaks. It's much more effective. The other mistake would be inconsistent use. These medications work best when used daily, especially the topical nasal steroids. So, not just when symptoms come about, but also as a daily maintenance use. People also forget about controlling their environment too. Things like keeping the windows closed or using air filters, checking pollen counts can also all help reduce exposures.
So it sounds like if you have allergies, you really need to be aware of the environment and the time of year and any early symptoms?
Absolutely. I mean, it brings a lot of different things into play, medication uses, looking out for the pollen counts, the weather. So there's a few different things at play that ultimately influences one's symptoms.
Can untreated allergies lead to other problems?
It can. Chronic nasal inflammation from allergies could increase your risk for sinus infections or ear problems like eustachian tube dysfunction, as well as asthma. In addition, untreated allergies may cause other symptoms like daytime fatigue, reduced focus, which can have other impacts on one's quality of life, or, for example, their school performance or behavior. So I think it is important that managing allergies isn't just for comfort, but it's also about kind of long-term control and controlling other aspects of one's quality of life.
You're listening to Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Assistant Professor of Otolaryngology and Communication Sciences, Dr. Mark Arnold. We've already talked about the prescription and over-the-counter medications that might help with symptoms, but what about home remedies? Is there anything that would help at home?
There certainly are. I think for starters, especially during high pollen counts, such as the spring with trees, keeping your windows closed, especially in the morning when pollen counts are typically the highest, using HEPA filters in your home, washing regularly, obviously, your hair and your clothes, showering before bed can help to remove allergens and protect yourself, as well as cleaning bedding once a week with hot water are all some home things to basically reduce the amount of pollen and kind of allergens on our clothing and in the air in our house.
If people have pets that go outside, are the pets liable to bring pollen in as well?
They can. I would be more worried about the pet dander themselves being a cause of allergy symptoms, but typically it is the wind that brings it in and carries it, and then ultimately brings it to our nose.
Then what about nasal irrigation? Is that effective?
It is, and I do recommend it to most of my patients. Saline rinses, whether it's products are called like a Neomed bottle or a neti pot or a squeeze bottle or even a powered device. This helps flush allergens and mucus from our nasal passages. So it's helpful when symptoms are present, including congestion, postnasal drip. I do say it's important that you have to use either distilled or previously boiled water, and also make sure to add saline to it because it makes it much more comfortable.
Can you explain immunotherapy and how well that works and when it might be used?
So immunotherapy is another class of medications to treat allergies. It includes both allergy shots and sublingual tablets. These work by gradually training your immune system by giving it small amounts of these allergens, and it induces tolerance over time. It is the only treatment that can actually change the course of the disease rather than just treating your symptoms. So it's very helpful for people with multiple allergies, those who are poorly responding to medication, or those that have asthma triggered by allergens. It does take time, up to 3 to 6 months to actually get a response, and it may be continued for 3 to 5 years, but it can be a pretty powerful treatment option for some patients.
So for those who the medications aren't really giving them relief, that might be an option to look into.
Yes, absolutely. The easiest is to start with these over-the-counter medications. Occasionally, there's some other prescription medications, and if those don't provide adequate control, depending on the type of allergy, immunotherapy could be considered.
Let's talk a little more about what people can do to avoid pollen in the first place. How do you tell whether pollen or mold counts are high?
One way is just simply looking outside. In the spring, we often will see pine pollen or other pollens covering our cars. That's one good, but especially looking online, there's many apps, websites. There's a National Allergy Bureau. There's websites like pollen.com that offer daily pollen forecasts, and that's based on real-time sampling of these local areas. And they also break it down by type too, including trees, grasses, and weeds. So that's probably the most helpful.
Which weather conditions are the safest or the best to go out in, and which ones are the riskiest?
So rainy, humid days tend to wash the pollen out of the air. That makes it safer for allergy sufferers. Whereas on the flip side, dry, sunny, and especially windy days are the worst when pollen becomes more airborne and widespread.
Is there a time of day when pollen counts are usually high or usually low?
They tend to peak in the morning between about 5 and 10 a.m., and they often drop in the evening. And some part of this too is especially after rainfall, pollen counts typically drop. So allergy sufferers may feel worse in the morning. They may also feel worse in the morning if they have sensitivities to indoor allergens like house and dust mites that they're exposed to overnight and they wake up congested in the morning.
But maybe the best time to walk would be after a rainfall late in the day, it sounds like.
Yep, that would probably be the safest.
Now, I'm thinking about yard work that has to be done. Would wearing a face mask help keep you from inhaling pollen?
They would. That is another environmental measure that people can use. Face masks, N95 masks, even goggles. Those all do help reduce our exposures. So that would help. In addition to over-the-counter medications if they wanted to take those.
What about if people are planning their yard or their plantings? Are there plants or trees that are best for people who have seasonal allergies?
There are plants that are insect pollinated. Things like roses, tulips, or petunias. They release less airborne pollen, so they're generally safer. In contrast, wind pollinated plants, things like trees, birch, and ragweed, they're much more likely to trigger symptoms because the shape of their pollen gets carried by the wind.
If somebody thinks that maybe they have seasonal allergies, do they come to a specialist such as yourself, or is this something that a primary care provider would work with them on first?
Because allergies or allergic rhinitis is so prevalent, up to 50% of the population has it. The first point of contact usually is a patient's primary care provider. And that would entail starting medications, reviewing exposures. And if after that, there are still having problems, having symptoms, it may be reasonable to see someone like myself or an allergist.
Oh, well, this has been very informative. I really appreciate you making time to tell us about this, Dr. Arnold.
Thank you for having me.
My guest has been Dr. Mark Arnold, an assistant professor of otolaryngology and communication sciences. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.